Hi there, my name is Kayla Johnson, and I'm a health educator and promotions coordinator in the Office of Health Promotion on campus at Southern Miss at Moffit Health Center. For Golden Eagle Welcome Week, we're going to take some time today and talk a little bit about sex, drugs, and rock and roll, and how you can stay healthy during your first semester and first year at college here at Southern Miss. I'm going to kick things off talking about sexual health basics, including sexually transmitted infections, common STIs, prevention, fact versus fiction, and sexual health and alcohol. Sexually transmitted infections are infections transmitted through sexual contact. You do not have to have symptoms or be showing symptoms in order to transfer an STI from yourself to someone else or vice versa. Left untreated, certain STIs can even cause complications like lesions, pain, secondary infections, infertility, and even death. Prevention of STIs can be simple. Of course, most people have heard of abstinence, which means you refrain from any type of sexual contact. And that's going to be the 100% way to protect yourself. Anything else, there's a slight chance. But if you're abstinent, there's no chance of any type of transmission. Another way to protect yourself would be to be in a monogamous relationship. So don't have multiple sex partners. Stay with one person, and don't practice high-risk sexual behaviors. Another thing is that you need to wear a condom or some type of barrier method of protection. We do actually have these available for free at Moffit Health Center, and these are also located at the main desk in all of the residence halls. So if you're living on campus, you'll have access to those there. But it's really important you use that. Now you'll see a graphic down in the corner there. Something that we talk about a lot is the dual method of protection. And so what we mean by that is even if you're on birth control, be it birth control pills, the depot shot, maybe NuvaRing, an implant like the Nexplanon, even if you're on a birth control, it's really important that you still use a condom as well, because even though birth control may prevent pregnancy, it's not going to protect you from STIs. So be sure you use both, not just one or the other. Also, don't have sex if you're under the influence of alcohol or any type of drug. If you're under the influence, you cannot give consent. So it's really important that you refrain from that. If you're under the influence, you're not going to make very smart choices. You may forget to use protection, and then that's going to open you up to potentially contracting an STI. Also important that you know the signs and symptoms of STIs. Again, want to make a point to say that not all STIs show symptoms, so you may still have an STI but be asymptomatic. And so the only way to know if you have one or not is to know your status and get tested. So this is something that's available weekly at Moffit Health Center. Monday through Friday you can come in and get tested, especially if you're newly sexually active or you're in a new relationship. Stop in, get tested prior to engaging in any sexual behavior, just so that you and your partner both know what your status is, and if you need any sort of treatment, that can be done before any type of intercourse. So now we're going to move into a little bit of fact versus fiction as it applies to sexual health. So what you'll see here is a myth of some sort followed up with the truth behind what some people, especially college students, may actually think. So you'll see here that the belief is that most people who have sexual intercourse will have a sexually transmitted infection at some point in their lives. The CDC actually estimates that youth ages 15 to 24, of course the traditional college students fall within that age range, actually make up just over 1/4 of the sexually active population, but despite that, account for half of the 20 million new sexually transmitted infections that occur each year. So that's pretty wild to think about if you kind of put that in perspective. So it's really, really important that you use protection so that you don't become one of those 20 million new cases each year. Another belief is that the reason people get STIs is because they have a lot of sexual partners. Now, while high-risk behaviors like multiple sex partners, do definitely increase your chance of getting an STI, especially if you're not using protection. It doesn't necessarily mean that those are the only people at risk. All it really takes is one person, one partner, to transmit an STI. And something to think about is the fact that, ultimately, if you're sleeping with your partner, but that person has been with, say, 2 other people prior to being in a relationship with you, then you're being exposed to those 2 people and those 2 people's partners as well. So a lot of times, students will just think, well, I'm only with this one person, when in reality, that person's been with all of these other people's as well. So it's really important that you get screened, that you get tested, especially as you enter new relationships. But at the same time, just know that anyone is susceptible to an STI, especially if they aren't using protection. Another common myth is that all STIs can be cured. So while some STIs like chlamydia, gonorrhea, syphilis, and trichomoniasis, or TRIC for short, can be treated with antibiotics, herpes, HIV, and HPV, all of which are viruses, are not curable. They're just treatable as far as the symptoms go. Now, I will say, as for gonorrhea, there is some concern that this will be a STI that eventually becomes uncurable or not curable, because antibiotics are getting to the point where they don't work as well, because there is a strain of gonorrhea that is becoming antibiotic resistant. So just keep that in mind. One way that we can prevent that from happening is by using protection, not having repeat gonorrhea infections. And just doing your part to protect yourself and protect your partner. So while some can be cured, just remember that not all of them can be. And of course, if there's no symptoms, you don't know. And so if you're not being safe, you're opening yourself up to potentially contracting an STI for which you'll have to live with for the rest of your life. So some people think that as long as they don't have intercourse, they're not at risk for an STI. But it's important to think about the different types of intercourse that there are, and the different beliefs that people have about that. So just because you may not be engaging in vaginal intercourse doesn't mean that you're not engaging in oral intercourse, for instance. It is possible to actually have an STI more than one area at the same time. So, for example, you may have one in the throat as well as the genitals. And so if you're not using some type of condom, dental dam, or other type of barrier method, each and every time, not just occasionally, but every time you have oral sex, then you're potentially exposing yourself to an STI. So if you use a condom or dental dam or some type of barrier method each time, you can ultimately reduce your chance of getting or giving an STI. So just remember, not all not all STIs have symptoms. So a person may not be symptomatic at the time. And so if you're not doing things to protect yourself in other areas of your body, you're opening yourself up to potentially contracting an STI somewhere other than just through the genitals. So the last little factor of fiction that we're going to talk about is in regard to symptoms. Some people think that if they don't show symptoms after a few weeks from sexual contact, then that means they don't have an STI. And so listed here, you'll see some of the symptoms that you may have, depending on the type of STI that you may have come in contact with. But I want to point out again, and I know I've mentioned it a couple times already, that oftentimes STIs don't have symptoms. So you will have no symptoms. And so therefore the only way for you to know is to come see us at Moffit Health Center or other healthcare provider and get tested. We can't stress it enough how important it is to get tested. So just because you haven't shown any symptoms and it's been a little while, maybe a couple weeks, maybe a couple months, doesn't necessarily mean that you're in the clear. You could still have an STI and just not know it. And so if you don't know your status, and maybe you engage in a new relationship, a new partner, whatever the situation may be, if you don't know your status, then you're taking a chance of potentially exposing someone else or exposing yourself if you're not taking the proper precautions. Okay, so now I'm just going to touch on a few quick statistics on sexual health and alcohol consumption. So you'll see here that underage undergraduates were 23% less likely to use a condom during sexual intercourse when they were drunk. So definitely lowers your inhibitions and your ability to make decisions, one of which would be choosing to wear a condom and protect yourself during intercourse. Another one is that young adult drinkers were twice as likely as non-drinkers to have had an STI during the past year. Those that were heavy drinking males are almost 4 times as likely to have had an STI during the past year, and heavy drinking females are 3.5 times as likely to have an STI during the past year. So just something to think about. You know, we say all the time that alcohol and sex don't mix. So you know, if you are old enough to consume alcohol, be responsible about it. We'll touch on that here in just a few minutes. But definitely don't want to mix sex and alcohol. It lowers your ability to make good decisions and make, you know, sound choices. So just, you know, if you can, by all means, refrain from mixing those two. So now we're going to switch gears a little bit and move away from sexual health and talk a little bit about alcohol basics. We'll discuss consequences of alcohol use for college students, legal consequences associated with underage drinking and driving. We'll briefly talk about blood alcohol contact, some fact versus fiction. We'll discuss alcohol poisoning, and then of course go over some information on responsible drinking for those who are 21 or older, just some ways that you can drink responsibly. So just to touch on a few consequences that we see related to alcohol use in college students, you'll see that 1,825 college students die from alcohol-related unintentional injuries each year. So this is motor vehicle crashes, maybe, you know, falling off of something that they were climbing on, etc. 696,000 students are assaulted by another student who have been drinking. So this kind of goes back to not being able to give and get consent when under the influence of alcohol or other drugs. 97,000 students report experiencing alcohol-related sexual assault or date rape. So, like the statistic above, you know, this could be sexual assault as well as like domestic assault as well. Roughly 20% of college students do meet the criteria for an alcohol use disorder, which is pretty unfortunate considering, you know, college students are so young. About 1 in 4 college students report academic consequences related to alcohol consumption. So this may be missing class, falling behind, be it on assignments or just attending class and getting things turned in on time. They may do poorly on exams or papers. And then, of course, because of all of those other factors related to having some problems with alcohol consumption, they may end up even receiving lower grades overall for their class or classes. So real quick, just to touch on some of the legal consequences for underage drinking as well as drinking and driving. I won't speak to each of these, but just wanted to make them available to you. This is how it applies in the state of Mississippi. So of course we know that the legal drinking age is 21. If you get caught underage drinking, you'll see the potential consequences there. And then of course, if you decide to drink and drive, there's some different consequences related to how many offenses, how many times you have been caught driving under the influence. And just know too that additional convictions may result in different penalties or more severe penalties, especially if there is a death involved. There's so many different ways that you can get home safely now. You got Uber, you got Lyft, you can call it taxi. There's just so many ways that you can get home without having to climb behind the wheel after driving. So whether it's using a designated driver, some type of driving service to get home, definitely don't get behind the wheel and drink and drive. Utilize one of these other services so that you get home safely and so that you don't put anyone else at risk while on the road. So I want to take a minute and just focus on a few common myths that you've probably heard, or if you haven't heard, you likely will hear. And so we want to inform you on the fact behind that fiction that you're hearing. So you may have heard, I'd be better off if I learned to hold my liquor. And so this is actually related to tolerance. So if you have to drink increasingly larger amounts of alcohol, whatever that alcohol of choice may be, but if you have to drink increasingly larger amounts to get that same buzz or high feeling, then you're developing tolerance. Tolerance is actually a warning sign that you're developing more serious problems with alcohol. So despite the fact that you may hear of, oh, I've got this high tolerance, I need to build up my tolerance so I can drink more, it's actually not a good thing. So tolerance isn't necessarily something to brag about, it's not something to work towards. It's actually a sign that there could be some other issues and serious problems developing with your alcohol consumption. And so, discourage your friends, from trying to keep up with each other and to drink more and more and more each time. Drink responsibly, be safe, set a limit for yourself on how much you're going to drink so that you don't get to this point. So the next couple points that we're going to talk about are related to people drinking and passing out. So you'll see there that a belief is that people pass out from drinking all the time. It's no big deal. It's nothing to worry about. The best thing to do for someone who is drunk is to put them to bed and let them sleep it off. And lastly, if my friend passed out, I wouldn't call for help. I couldn't live with myself if I got them in trouble. And so the flip side of that is that, if a person does pass out from drinking, it's because the body is losing its ability to tolerate the amount of alcohol. So if you pass out, your body's ability to tolerate how much alcohol you're putting in is ultimately going to affect how your body functions. And so the amount of alcohol it takes to make you pass out is really close, dangerously close to the amount of alcohol it would take to make you dead. So if you're drinking to the point that you're passing out, if your friends are drinking to the point that they're passing out, this is a serious concern. It's not something to take lightly, and you definitely don't want to leave that friend alone. Stay by their side. We'll talk here in just a few minutes about alcohol poisoning and ways that you can help your friends should they get in a situation where they're passing out, blacking out, or you're fearful of alcohol poisoning. But just know that passing out is not a good thing. In terms of letting someone who is drunk just sleep it off, again, don't leave a drunk person or an intoxicated person alone. It's super important that you stay with them, that you keep a constant check on their breathing, check their skin temperature, wake them up frequently, even if they get mad, wake them up. And if you don't call for help, just because you're worried that your friend's going to get mad, then you're choosing to take a chance of your friend not actually living to be mad at you. So it would be better to take that chance, get help for your friend, than not act, leave them alone, and take the chance of losing them. through loss of life. So, you know, at any point you have any doubts about their safety, their well-being, your ability to help them, definitely call 911, get them some help, and get them in the hands of some medical professionals. So the next few slides that we're going to focus on are all related to alcohol poisoning. There's a quick little acronym here that I want you to remember, especially if you find yourself in a situation where you're at a party and someone has been drinking heavily and finds themselves in a not so safe position or situation. So know the signs of alcohol poisoning. A good acronym to remember is CUPS. A lot of times you're going to use a cup to drink out of, so just kind of commit that to memory. But CUP stands for cold, clammy, pale, or bluish skin. That's your C. U is going to be unresponsive, unconscious, or semi-consciousness. P is for puking, and then S is for slowed or irregular breathing. So these are the things you're going to want to look for should someone that you're around start exhibiting any type of issues related to their drinking. Other signs to know of, if you can smell a strong odor of alcohol, if they seem disoriented, if they're experiencing any type of mental confusion, this can be a sign of alcohol poisoning as well. Some ways that you can help a person with alcohol poisoning, definitely stay with them. Again, we said on the slide before that you don't want to leave a drunk person alone anyway, so you definitely don't want to leave a person that you suspect may have alcohol poisoning. Don't want to leave their side. Instead of just laying them in bed, make sure that they're on their side. So the benefit of them being on their side is if at some point they do begin throwing up, they will be able to throw up, on the floor or wherever you might have them laying, rather than them laying on their back. If they're laying on their back, they could aspirate into their lungs, choke on that vomit, and then die. So it's extremely important that you have them on their side, so that if they vomit, they're not taking a chance of choking on that vomit. Also check their breathing, see how they're breathing, the rate of which they're breathing. Keep a check on their temperature. Try to wake them up fairly often. Even if they get mad at you, wake them up. And then, of course, seek medical attention. Call 911. Find someone who can help if you see that things are getting progressively worse, or if you're fearful for the safety of that individual. So again, we've talked a little bit about what alcohol poisoning is and the signs and symptoms to kind of look out for and how you can assist someone. But alcohol poisoning actually occurs when there's so much alcohol in the bloodstream that areas of the brain controlling basic life support, so your ability to breathe, your heart rate, your body's ability to regulate temperature, all of that begins to shut down. So if you remember, we talked about checking the breathing, monitoring their heart rate by checking for a pulse, and then also checking the temperature often were some ways that we can assist with helping someone who may be experiencing alcohol poisoning. The reason behind that is because the alcohol in the bloodstream does affect those life support functions. So really want to be mindful of the fact that even if you quit drinking or if the person becomes unconscious, the blood alcohol content, or blood alcohol level in their bloodstream can still continue to rise, despite the fact that that person has quit drinking or has become unconscious. So it continues to enter the bloodstream, it's circulated throughout the body, and it's super dangerous to assume that, once the person's unconscious, you can just leave them to sleep it off and they'll be fine. That's why it's really important that you stay by them, that you try to wake them up regularly, and just continue to check, breathing, heart rate, etc. If you do suspect someone has alcohol poisoning, get medical help immediately. Call 911, call someone, in an authoritative role. They can assist you in getting that person the help that they need. Cold showers, hot coffee, going for a walk, all of those things are not going to help a person who is going through an alcohol overdose or alcohol poisoning. They're not going to help at all. So despite what some people may think, they're just not effective in helping that individual. The side effect of that would be that they could actually make things worse, especially, the walking around part. If they're disoriented, unconscious, trying to get them to walk around may actually lead to more accidents and just overall making the whole situation worse. You'll see a few symptoms there, a few signs that indicate a life-threatening situation related to alcohol poisoning. So just be mindful of those things and be prepared to help your peer should the situation arise. So this is just a few more quick little tips, reiteration of what we've talked about in the previous couple slides. Good little graphic for what to do, and then a quick little reference for what not to do. We've talked about all of these in the last couple slides, so this is just a good way to commit these things to memory if you find yourself in a situation where you need to help someone, intervene, call for help, etc. So just be mindful of these tips when you find yourself in that situation. Alright, so before we wrap up talking about some alcohol basics, I want to touch on a couple things related to responsible drinking. Of course, first and foremost, do not drink unless you are 21. Of course, we've already mentioned that the legal drinking age is 21. And so the first thing that you can do to be responsible is to not consume alcohol if you are underage. If you are of age and decide to drink, don't drink alone. If something happens, or say you become overly intoxicated and you're alone, then there's no one there that can call for help should you need it. Definitely want to eat something substantial before drinking. Having something on your stomach will help slow that rate of absorption and help your body kind of process that alcohol intake so that you don't end up in a situation where you get drunk really fast and end up maybe with alcohol poisoning. Also know what you're drinking. That goes hand in hand with not accepting a drink from someone you don't know. So, make your own drink, watch your drink being made, and of course never drink from a punch bowl because you really have no idea what has been put in that punch bowl. So, always know what you're drinking. Know where your drink is at all times. Don't set your cup down and walk off to the restroom and then come back and pick it up. When in doubt, pour it out. Don't take the chance. Also want to know how much you're drinking. Be mindful of how much you're consuming. Avoid drinking games. Peer pressure may be to join in, be on a team, etc., whatever the activity may be. But you're going to want to avoid that because participating in drinking games can get you in a lot of trouble. It can get you consuming too much alcohol too fast and just get you in a bad situation. Also avoid drinking shots of liquor as this too can potentially lead to alcohol poisoning as your body's not able to keep up with the amount of alcohol you're putting in. Again, drink slowly. Kind of goes hand in hand with knowing how much you're drinking. Pace yourself. Don't gulp, don't chug. And then alternate your alcoholic beverages with your non-alcoholic beverages. So if you have, say a beer, make sure you're drinking water next. And just alternate those so that you're spacing out your drinking and you're drinking slowly. Don't mix alcohol and medication. If you're taking medication that says avoid alcohol, don't drink. There's a reason for that. Another thing that you can do is stop drinking at a predetermined time. Maybe leave the party or leave a bar at a predetermined time. And then make sure you go home with a friend. Buddy system is important. If you're drinking, if you're going to be drinking, make sure you've got a friend and you've made arrangements to get home safely. For some students, believe it or not all college students drink. So if you do, come in contact, interact with a student who doesn't want to drink, Be respectful of that. They do have the right to not participate in drinking alcohol if they so choose. So respect that right. Don't use peer pressure to talk them into drinking. Just let them be there, have fun, but don't pressure them into doing something they don't want to do. Again, I've touched on this several times. Alcohol and sex do not mix. Drunken sex is not consensual sex. So just don't mix the two. Avoid getting into a car with someone who has been drinking. So again, there's so many different ways you can get home safely now, via Uber, Lyft, maybe you've got a designated driver. Just whatever you do, don't put yourself in a situation where you could be harmed or someone else could be harmed behind the wheel. And then, of course, never drive a car after having a drink. Even if it was only one drink, don't take that chance. Be sure to use a designated driver. So the last thing that we're going to talk about as part of this presentation is sexual assault and consent. So we'll talk a little bit about incapacitation and sexual assault, touch on what consent is, and then how you can report sexual misconduct in amnesty should something happen, get you the right contacts and resources for assistance if you need it. So we've already talked a little bit about how sex and alcohol don't mix. So we've already said that drunken sex is not consensual sex. And so the same kind of goes for being incapacitated. So if you're incapacitated, it's a state where someone cannot make rational, reasonable decisions because they lack the capacity to give knowing consent. So this would include any mental or physical incapacitation by alcohol or drugs, a mental disability, and or sleep. You'll see some statistics there, but the main thing to know is that a person who is unconscious, if they're passed out, whether it be from alcohol, drugs, any type of illness, the person cannot give consent to sex. So if sexual contact does occur, it is sexual assault. So just know, any type of incapacitation, again, whether it be drugs or alcohol or some sort of illness, a person cannot give consent. So I've used the word consent several times, but I want to touch on what consent actually is. So when we talk about consent, it is a clear, unambiguous, and voluntary agreement between participants communicated by clearly understandable words or actions to engage in each form of sexual activity. So no matter what, you are responsible for obtaining consent. It should never be assumed. So even if you had consent from your partner last Friday, that doesn't mean you automatically have consent from your partner this coming Friday. Each time any type of sexual activity occurs, consent should be obtained, no matter what the situation is, each time. The absence of a no does not mean that you have consent. A clear yes, verbal or otherwise, is necessary. So if you don't get a yes, that means no. Consent does not need to be verbal, but of course verbal communication is the most reliable. A current or previous dating or sexual relationship is not consent. So again, like I said, just because you had consent last Friday doesn't mean you'll have consent next Friday. You can't just assume that. Ask each time. Consent for one form of sexual activity does not mean that you have consent for all other forms. So if a person is okay with, say, vaginal sex, it does not mean that they're just automatically going to be okay with oral sex. That is something that you would have to ask consent for. It's different forms of sexual activity, so that is also something that you would need to ask consent for. So you can't just assume that what's good for one is good for all. Again, consent can be revoked at any time. So even if your partner was okay with things at first, and you get into it and then they change their mind, they have the right to do that. So they can revoke that at any time. And at that point, you would have to stop, or it does become sexual assault. Now, consent can't be given where there's a threat of force or violence or any other form of coercion, be it through intimidation, physical or psychological violence. So just know that you've got to have consent each and every time. It should be clear, it should be concise, and it should be easily and clearly understandable through words or action. So you'll see here, these are just a few fun graphics as it relates to the consent definition. Some easier ways that you can kind of remember what consent is. You'll see that it's clear, coherent, willing, and ongoing, meaning that consent is active. It's coherent, so that we know if a person is incapacitated by drugs or alcohol, they cannot give consent. It is willing, so it's never given under pressure. So like we were saying before, it's not, fear is not used, or any type of other coercion. It is willingly given and not given under pressure. And then, of course, it's ongoing. It has to be granted every time. It's not an automatic just because you're in a relationship with someone. It's something that should be gotten each time. And then another way to think about it is fries. It's freely given, it's reversible, of course, at any time. It's informed, it's enthusiastic, and it's specific. So just keep these things in mind as you, if you enter a romantic relationship or any type of partnership where sexual activity may occur. Just keep consent in mind and know that you have to ask each time that any sexual activity may occur. Now that we've talked a little bit about consent and sexual assault, I want to give you some information on how you can go about reporting sexual misconduct and amnesty here at Southern Miss. And so the health and safety of every university community member at Southern Miss is of the utmost importance. The university does recognize that students who have been drinking and or using drugs, whether voluntary or involuntarily, at the time a sexual misconduct incident occurs, may be hesitant to report such an incident due to fear of potential consequences. Under this amnesty policy, the university strongly encourages students to report incidents of sexual misconduct to campus officials. The key thing here that we want you to remember is that a bystander reporting in good faith or an alleged victim reporting sexual misconduct to the university officials or law enforcement will not be subject to campus conduct action for violations of alcohol and or drug policies occurring at or near the time of the sexual misconduct. It's important that you come forth with the information that you have and not be fearful of any consequences that may result. The amnesty policy will protect you as long as you're coming forth in good faith. Lastly, we just want to leave you with some contact information for some campus resources associated with the topics that we've gone over today. You'll see there student counseling services. They do see students for counseling. This is a free service to students as long as you're enrolled at Southern Miss. You'll also see student health services there. We do provide medical care at our clinic, so we talked heavily about STI screening. If there's concern for an alcohol use disorder or just alcohol use in general, anything like that, you can come see us at Moffit Health Center. Eagle Checkup is something else that's available through our clinic. It is indicated prevention program focused on students who use alcohol and or marijuana. And this is just a way to do some early intervention to help students who may be struggling with alcohol or marijuana use. Something else that we have on campus is a Title IX office. You'll see the contact information there as well. These are going to be the people that you go to, should there be an instance of harassment, discrimination based on a person's sex, gender, gender identity, sexual orientation, pregnancy, parenting status, etc. And they implement and oversee the university's sexual misconduct policy that we just spoke about a few slides back. And so anything related to sexual misconduct would be reported to the Title IX coordinator. Something else that we have at Southern Miss is the Campus Action Referrals and Evaluation System, or CARES for short. And this is a team of campus professionals who respond to reports of concern regarding the academic progress and well-being of students. So if you have a friend, roommate, classmate, whoever on campus that you are concerned about, maybe it's their mental health, maybe it's just their overall well-being, maybe it's they're struggling with class, etc., you can report that to the CARES team using the CARES system, and someone from the campus care team will follow up with that student. It's completely anonymous. It's a way for you to, get help for getting your friend, roommate, etc., and do so without fear of that person finding out or any type of, repercussions to your friendship, etc. So just be aware there is a link there. I believe it's also accessible through most of the web pages through the USM website. And so just be mindful of that if you end up needing it, again, for a friend, roommate, classmate, teammate, whoever. If you just know someone that is in need and there's a community member, campus community member that needs to follow up with them, you can certainly do that. And then lastly, of course, we want to thank you for tuning in for this presentation. Know that Moffit Health Center is always here for you should you need any help. If you need to be checked out, you need to see a provider, maybe you need some med refills, whatever the situation may be, feel free to reach out to us. We are open Monday through Friday, fall, spring, and summer semester. So if you need us, just give us a shout, shoot us an email, and of course, more than anything, welcome back. Welcome to Southern Miss, welcome to campus. We're so excited to have our students back and are looking forward to everything that fall has in store. Southern Miss, to the top.